we match your medications to your DNA. So you know exactly what's going to work for you and what you should avoid. My name is Cathy Cather, and I am the CEO and co-founder of Parallel Profile. And what we do is really exciting. We match your medications to your DNA. So you know exactly what's going to work for you and what you should avoid. This all started because I used to prepare for board meetings at a 7-hospital system, the never events, things that should never happen, but do. So when I was in the ICU bedside and my husband was having something going on that they didn't recognize, I recognized it. I knew he was having an adverse drug reaction. And the reason I knew it is because it's so common. 128,000 deaths a year, 2.7 million hospital inpatient admissions for $211 billion a year. This is completely wasted money, and somebody's paying it. Here's more waste. 90% of drugs don't work for a lot of the people that are taking them. All wasted money. We also have in the industry right now a lot of discussion about health equity and the racial inequity that's inherent. And a lot of that has to do that we're different biologically by race. And as you can see, how people respond to medications varies depending on their DNA makeup. In fact, 43% of all people tested were currently taking a medication outside their optimal zone. Now, who's paying for all this? Well, our market is who's paying 48% of it, large self-insured employers. Large self-insured employers who also care deeply about racial equity, who care about waste, who care about the cost of healthcare getting out of reach for them and their employees. So what we did is we developed Parallel Profile and we took it to Fortune 500 employers. Having led the healthcare strategy practice for Fortune 500 employers at a leading benefits firm, I already knew all these people. So we went back and we showed them what we did. They tried it. The people in charge of benefits and HR tried it. They tried it for their kids. They tried it for their parents. They gave us their feedback, and then we developed it based on what they taught us. And the next year, they named us one of the top 10 most innovative healthcare companies in the United States, and these were the people who voted for us. So what makes us so special? Well, we listen to them. There are competitors, and they're really good at the science. The science, terrific. It's very complex, but it's actually the easy part. The hard part is adoption and integrating it into the current workflow without disrupting it, because healthcare is so chaotic right now. Another disruption just really is a barrier. So what we did is we built it into what they are already doing. And so what we're looking at is about almost $1 billion revenue within 5 years based on totally working with these employers. We've already raised quite a bit of money to get to this point because we did build it, test it, and revise it. And now what we're looking for is another $2.5 million to build a multi-tenant platform. That's because every employer doesn't just pay for their employees' healthcare. They also hire case management companies and PBMs and all these other vendors who interact with their members on a regular basis. And those people have the opportunity, I think the responsibility, to use this information when it's available. So what we're doing is we're integrating with, we've already got an agreement to integrate with 8 PBMs. We're integrating with second opinion companies, case management, care management companies. And we're doing this with an amazing group of people with amazing background, a lot of experience, not only in healthcare, but genetics, clinical care, and of course, employer benefit programs. So the employers are ready. They just want us to be integrated with everything else so that once they have the information, it actually gets used. Thank you.
You know, a question that popped into my mind was just around your team, and you addressed it for a couple seconds, but this is a very complex challenge. And so I wonder if you could just talk about your advantage in terms of your personal and your team's ability to address such a complex data challenge?
Well, one of the things is when you've been in the industry like we have, like, for example, Dr. Wisniewski and I mean, he was the chief medical officer for Marriott for all their employees. And I was the, benefits consultant designing the health plan for people like Marriott. And we knew everything that we tried. When I look at my other clients recently, like Quantum Health and Consumer Medical and Accolade and Pinnacle Care, One Medical and Teladoc, these were all clients of mine that I taught them how to get into employers. That's what my consulting gig was for all these people. And as we put all these other products in and we hit a barrier, great product, but nobody was using it. Or great product, but it contradicted some other great product they were doing, or overlap, and people didn't know where to go. This is 20 years of going down cul-de-sacs and having to turn around and come back out and turn around and come back out. So the more people you have who've done 20 of these, the more apt you are to shortcut and get on the straight road.
Yeah. You have vast experience in this market and you've seen attempts at this solution fail. What is special about this moment in time where you feel like you're primed to make these next steps with Parallel Profile?
That's a great question. January of next year, employers have to, by federal law, be transparent about drug pricing on 2 drugs. But a year from now, January of 24, they have to be transparent on all of them. And what our app does is it allows any member to put in the first 3 letters of any drug name, and it immediately will tell them which one not only is the most genetically safe and effective, doesn't interact with any of their other medications because we get a download from their PBM, but also which one is the lowest out-of-pocket price. So the optimal drug. So when you're standing in the doctor's office or at the pharmacy counter, over the counter or prescription, you type in the first 3 letters because no one can spell anything, and then click on the right one. And immediately you know the optimal drug for you. We're also negotiating with the employer so that if the only good one, the only safe, smart one is more expensive, they're actually going to lower your out-of-pocket so that you never have a financial disincentive for doing what's best for you. So instead of having a company formulary, drug formulary, you will have a precision formulary based on what's best for you.